Hello everyone, I am Dr. Jayant Mude from the Department of Surgical Gastroenterology and GI Oncology at Majumdar Shah Medical Center, Narayana Health City, Bangalore. Today we have the eminent speaker and the senior consultant, Dr. Ashwini Kumar Kudari. He is the head of the Department of Surgical Gastroenterology and GI Oncology at Majumdar Shah Medical Center. And also Dr. Shushu Shetty, who is a consultant in the same department. Today we are here in this Facebook live session to discuss about the topic on what do we have to know about the gallbladder stones and the gallbladder cancer. This month of February is observed as the Gallbladder Cancer Awareness Month worldwide. In this regards, we are here to discuss about the management of gallbladder cancer and gallbladder stones, which are frequently attributed to gallbladder cancer. My first question is to Dr. Shushu Shetty, sir. Hi sir. Why do gallstones occur in the first instance?
Gallbladder stones are very common entities. Each one of us would have heard about it through a friend or a family member or oneself having suffering from gallbladder stones. Basically, gallbladder is a small sac-like structure that is located under the surface of liver, whose main function is to collect the bile, that is the liver juice that is secreted, and release it whenever someone ingests food. So why stones occur in gallbladder? There are several theories to it. One most important theory is a supersaturation theory, wherein the liver juice is supersaturated with cholesterol. And somebody who consumes a diet rich in cholesterol, somebody who consumes diet rich in carbohydrates. Other factors which contribute to gallbladder stone formation is a hypofunctioning gallbladder. The gallbladder may not pump bile adequately, or a patient with the hemolytic anemia, where the bile is saturated with bilirubin. Patients suffering from hemolytic diseases, or in patients who have a rapid weight loss, patients who have irregular food timings, maybe prolonged fasting, and who have less physical activity.
What are the symptoms one can experience in the case of gallbladder stones?
Most commonly, many of the gallbladder stone patients may not be symptomatic. Whenever symptoms occur, they usually have pain abdomen, mostly located on the right side in the upper abdomen or in the center of abdomen. Pain is usually precipitated by a fatty meal or a heavy meal and lasts for 1 to 2 hours, after which the patient is relieved of pain. Again, the pain may occur in an episodic way, and the interval between the episodes may be of a few hours or maybe a few months. This pain may be associated with nausea or vomiting. Whenever there is some complication, the patients have more prolonged pain, more severe pain, may be associated with pain relating to the back, can be associated with fever or jaundice, whenever there is any complications due to gallstones.
Who are the patients that should undergo surgery for gallbladder stones? And are there any other alternatives to surgery?
You can classify it as patients with symptomatic stones and patients with asymptomatic stones. Coming to patients with symptomatic stones, everyone at appropriate time should undergo surgery. Symptoms can be in the form of intermittent attacks of pain or biliary colic, where pain comes at irregular intervals of time and it usually lasts 10 to 15 minutes. These are the patients who can undergo elective gallbladder surgery. There can be symptoms of acute cholecystitis where there is an infection in the gallbladder and these people experience continuous pain and they can have fever and vomiting. These patients can undergo surgery during the attack of acute cholecystitis, and the preferable time will be up to 48 hours of the attack, but you can do up to 1 week from the attack of acute cholecystitis depending on your investigations which are available. And also patients sometimes the gallbladder stones slips into the bile duct and they can present with jaundice or cholangitis, where the jaundice is associated with fever and chills. These patients, those who are straightforward bile duct stones, we usually perform ERCP and bile duct clearance by a medical gastroenterologist, and in the same setting we do cholecystectomy. Those who are in cholangitis, they undergo the drainage of the bile duct system first by a ERCP stenting or a procedure called PTPD, where the radiologist puts a tube inside the biliary system to control the infection, and these people can undergo surgery after about 4 to 6 weeks. This is a treatment strategy for the symptomatic stones. There are few patients who are not at all symptomatic for the gallbladder stone. They may get diagnosed during medical checkups or ultrasound examination done for some other purpose. People, get diagnosed with gallbladder stones. So the literature says the asymptomatic stones need not, undergo surgery immediately, but there are certain subgroup of patients under asymptomatic category who require surgery. Some of them may be, from the endemic area for gallbladder cancer. In India, it is the Ganga River Belt, mainly the Delhi, Jammu and Kashmir, Uttar Pradesh, Bihar, West Bengal. These patients they have relatively a little bit higher incidence of gallbladder cancers when they have gallbladder stones. These are the people who may benefit from elective cholecystectomy even though they don't have any symptoms. There are young females who are planning for pregnancy, and if they know that they have gallbladder stones, for them also, it is better to undergo gallbladder surgery. Patients who have sickle cell anemia, and if they are diagnosed with gallbladder stones, they also should undergo elective gallbladder surgery, because you will not be able to differentiate whether they have sickle cell crisis or acute cholecystitis, because both of them present with a severe attack of abdominal pain. So these patients should undergo elective gallbladder surgery even in an asymptomatic stage. And you asked So the gallbladder stones, the only modality which is effectively available is surgery. There are no medicines available which can dissolve the gallbladder stones.
So, how major or minor is a gallbladder removal surgery? And do one need to follow any lifestyle restrictions following cholecystectomy?
I feel there are no major or minor surgeries. I consider all surgeries as major. Even the nail removal, which is done under local anesthesia, has its own risks. So people should not get carried away by saying that this is a minor surgery or this is a major surgery, because all surgeries have its own complications. Even though the rates of such complications in experienced hands are very minimal, but they should not feel that it is a minor surgery.
Do one need to follow any lifestyle modifications following cholecystectomy?
There is a myth that people, when they come to OPD, they say that after removal of gallbladder stones they will have some digestion issues or some other they have to modify their lifestyles permanently. All those myths are there in the minds of people, but from our experience we feel that there is no lifestyle alterations required after gallbladder surgery. You can continue to live as you were living before the gallbladder surgery. There are no lifestyle modifications required.
Next, coming to the gallbladder cancer. As we have discussed till now, gallbladder stones are the very common entity. In contrary to this, the cancers affecting gallbladder are very, very rare. In spite of its rarity, the month of February is observed as the month of awareness about gallbladder cancer worldwide. It is because of the reason that gallbladder cancer is one of the most aggressive tumor known to the mankind till now. So my question to Dr. Sushil sir. Sir, why does gallbladder cancer occur, and are there any particular measures we can take to prevent gallbladder cancer?
Like in many other cancers, the exact etiology of gallbladder cancer also is not known. But what is known is that majority of the patients who suffer from gallbladder cancer get diagnosed with gallbladder cancer, coexisting gallbladder stones. So one may propose that chronic effect of this gallbladder stones may predispose. The incidence of gallbladder cancer is very, very rare compared to gallbladder stones. The other factors which may predispose to gallbladder cancer are certain environmental factors and geographical factors. As Sir had mentioned, the incidence of gallbladder cancer is higher in certain areas like the Ganges belt in India. It could be because of certain industrial pollutants that may be present in the food and water which people consume in these areas, or could be certain families which may be predisposed to the development of gallbladder cancer.
Are there any particular measures we can take to prevent the gallbladder cancer?
Since there is an association of gallbladder cancer with gallbladder stones, certain precautions which may be taken, like lifestyle modification, living a healthy lifestyle, maintaining an ideal body weight, avoiding alcohol, avoiding tobacco, consuming a diet rich in fibers and antioxidants may help to an extent in preventing gallbladder cancer. More importantly, certain people with a known family history of gallbladder cancer or hailing from geographical areas with very high incidence of cancer, it may be a good idea to screen them for gallbladder stones and gallbladder cancer.
How do we diagnose gallbladder cancer, sir?
Most commonly, the gallbladder cancer gets diagnosed when someone gets operated for gallbladder stones and the gallbladder specimen is subjected to histopathology. This is how most of the early gallbladder cancers are diagnosed. Otherwise, a basic screening ultrasound can pick up a gallbladder cancer, can be further evaluated using a CT scan or an MRI scan as required.
What are the treatment modalities available for the treatment of gallbladder cancer?
The main modality for the treatment of gallbladder cancer is surgery. First, when we diagnose a patient with gallbladder cancer, we have to stage them with a CT scan of the chest and abdomen or a PET CT scan. Once we stage it, we again subdivide them into a resectable or a non-resectable gallbladder cancer. The main reason for unresectability can be a metastatic disease, or the disease is locally advanced and it is infiltrating the surrounding important structures. So in these unresectable patients, we offer chemotherapy. Sometimes after chemotherapy, the locally advanced unresectable tumor can be downgraded and it will come to a resectable stage where they can undergo surgery. The main modality of treatment in a resectable patient with gallbladder cancer is surgery, where we perform a procedure called extended cholecystectomy, which involves the removal of the gallbladder, part of the liver, and the surrounding draining lymph nodes.
Sir, can minimal access surgery be applied for gallbladder cancer surgery?
Yes, minimal access surgery, there are a lot of reports available which say that the minimal access surgery can be effectively used in the form of a laparoscopic surgery or a more advanced technology, the robotic surgery.
So, diagnosed with gallbladder stones, do one need to fear about gallbladder cancer?
It's a very difficult question to answer, but going by statistics, the incidence of gallbladder stones are very high, but the incidence of gallbladder cancer in the same subgroup of patients with stones is very low. It is said that there is about 5-fold increase in the incidence of gallbladder cancer in patients with stones, but the patients who come from geographically more prone areas, I think they should undergo gallbladder surgery even if they don't have any symptoms. But otherwise, all people with gallbladder stones need not get worried about the gallbladder cancer.
So, the patients presenting and undergoing surgery for very early stage gallbladder cancer will have a near normal survival, whereas the patients presenting with stage 4 disease will have survival figures ranging in only few months. So, this further emphasizes that one should be aware of this disease and should seek medical attention as and when indicated. So, thank you for giving us this opportunity. Thank you, sir.
Thank you.
Thank you, sir.